today's conversation. I'm Chelsea Dade, the founder and owner of Communicate for Health Justice. And if you're new to this channel, Communicate for Health Justice is a young person driven communications and advocacy firm mixing equity and social justice concepts into health communication ideas. Started in 2018 and became incorporated in 2022. We provide a variety of services along data analysis, community storytelling, content creation, all with the goal of making sure that young people have a voice in today's and tomorrow's healthcare system and all things that relate to health. So really excited for you to be here. And I'm going to go ahead and talk a little bit more about why we're here today. So I'm speaking with World Renew Kenya. And World Renew is a nonprofit, global nonprofit, but they have different branches across the world. And World Renew Kenya has been working with communities, churches, and local partners in Kenya since 1972. World Renew supports locally led projects in all 5 areas of their programming: food security, economic opportunity, community health, disaster response, and peace and justice. So this is from their website, but I'm just reading it off here. Despite a growing economy, Kenya still faces significant challenges in its development. The agricultural sector remains central to Kenya's economy and provides livelihoods for more than 80% of the population, especially in rural areas. However, over 1/3 of the population still lives below the international poverty line, and nearly 30% of children in rural areas are stunted in their growth. Climate change, extensive droughts, inefficient food systems, and population growth have all increased Kenya's vulnerability to food insecurity and poverty. And so, you know, the reason why I reached out to World Renew is there's a lot of different aspects of the work that they're doing that's very intentional, and especially they have a model of asset-based community development, which is something that, you know, I talk a lot about the American public health system and how it's not always necessarily focused on people's strengths. A lot of times it's focused on people's I guess weaknesses. So the idea that World Renew is focusing on, you know, people and their power is really impactful. And so that's why I wanted to have them in the conversation today. So I'm working on getting them up on the stage, so bear with me. Hello.
Yes. Are you able to hear me?
Yes, I'm able to hear you. I just talked about the amazing work that World Renew is doing globally. Yeah, please feel free to introduce yourself and you can share a little bit about the work that you're doing.
Thank you so much, Chelsea. My name is Jacob Opara from World Renew. We're based in Kenya, and it's a first experience for us. We haven't used Instagram Live for this kind of engagement, so we might be having some challenges trying to fit in. But also, I have colleagues also joining me. There's Samson Sifa also joining in, listening in a minute, and also I have another colleague called David Njoka. And so I had a bit when you discussed, we read about our work, so I could just maybe do another quick overview about what you do. So for those who are hearing about us for the first time, we are a faith-based organization headquartered in the UK, in the US and Canada, and we have operations in different countries, about 16 countries in East Africa, where we're going to share some reflections around this whole question of gender justice and gender and social justice. Just in terms of introduction, we are part of the development arm of what's called the Christian Reformed Church of North America, so that they do a lot of good work across all over the world. And so here in Kenya, we have been in operation since 1985, so we're fairly old. in our work here in the country, where we work across. That is a map of Kenya, and all those colored places is where we work here in Kenya. So the administrative units in Kenya are called counties. There are a total of 47 of them. We have for president about 16 of them. And our reflection today, there's a small part of the country called Turkana. Is in the northern part of the country, is very dry usually. There's a programming interventions we have in that place, a small village called Katilu. And it's the one that is marked in purple, if you're able to see the very top. So it's a small village that has about 50,000 people that are largely pastoralists. So that means they move a lot. Their culture is a lot of movement from one place to another, and that part of the country is very dry usually. Suffers from a lot of climate change issues that has challenges around food insecurity. And statistics indicate about 70% of the households there have challenges with food security. Also, health indicators in the area is lower than the national average. So basically, and it's very arid. It's among the very dry parts of the country, in the northern part of the country. So it has a lot of shortages around water and has huge vulnerabilities caused by climate change. And so usually because of these climate-related challenges, there are usually a lot of resource-based conflicts. So that area is also very predominantly affected by conflicts. So inter-clan conflicts and what is called cattle rustling. So that's where, because they are pastoralists, they keep a lot of animals, that's cows, cattle. So the different communities raid each other as they struggle to get field for grazing. They struggle to get just to have the cattle as their possession. So there's a lot of conflicts that are associated with it. And we wanted to share some reflections from this part of the country in our work because of those conflicts. There's a lot of challenges that women and girls, especially as marginalized groups, then face. Some of which we will share with us today. So part of the discussion today was to reflect a bit more on equity and social justice, why it is important for all of us after that introduction. So we think that there are 4 points that you could say we think is very critical why social justice is important. As for instance, speaking on our behalf as a faith-based organization, we are heavily convicted in our work. And so the issue of justice is very core to the mandate that World Renew has, where we seek to help people experience experience Christ. So then justice becomes very core in the things that we do. So it's very, very foundational to how we look at things, how we try to intervene in our engagements with communities around us. Then second one is that there are cultural norms that deny the context in which we come from. There are a lot of cultural norms that sometimes deny equal rights, especially for women and girls. So so that it looks like women and girls are often left behind. So then it behoves us as, if you want to call it progressive, people who try to do good, and anyone else who in their hearts they try to do good, that they will want to be very sympathetic or empathetic to the plights that then these marginalized groups experience, in which case then calls for equity and social justice then become very foundational to us, especially in those spaces where the cultural norms that defy those equal rights. Then justice is reinforced and undermined, especially also, again, like I've said, the context in which we operate. Yeah, there's a lot of in situations where justice is very undermined. Bad things happen to people, then sometimes the systems that we exist in, sometimes the cultural orientation of our communities kind of create very disproportionate effect against those who are marginalized. And usually women and girls are very heavily marginalized. And in some of the areas that this happens around health areas, we'll maybe mention a few things around it, but largely also just another question of gender. Then lastly is why this is important. We think it's structural inequalities demand action. Like I've said, maybe experiences may be different for other people, but for us in Kenya, there still remain a lot of structural inequalities in how societies respond to issues and how people have access to some resources or some benefits or some services. And so there's those inequalities that, especially our communities, are still largely patriarchal, and these are structural orientation of society. So then it becomes very difficult for marginalized groups, being men and women and children, to access some of these services or access resources. So we think that if we exist in a society that has this level of inequalities, then it behoves us to be very intentional in how we advocate for equity and social justice. So that is largely the background for which we think it should matter to all of us, especially if there are those on this live feed who come from environments that still experience like what you experience here in Kenya. The two photos you're seeing on the screen, if maybe my camera is not very clear, but if you're able to see them, there is a lady, one of the ladies at the top. There is a lady from that village, that community called Katilu, and she's talking to farmers, and she's part of a program that we have been running in that area that is advocates for climate advocacy and gender equality. And she's a very interesting story because then this community is largely patriarchal, and it's not very easy to find women who convene sessions or talk to men, and the way it is seen here. So you see the men are sitting down and she's communicating with them. So she's one of the local leaders who is part of a farming program in that place, and it has been because of some of the interventions we've been having, capacity building them, this community, and trying to support them to be able to extend either their level of sensitization around gender justice and allowing women to be part of these processes in the community. The second photo there is a community leader during one of those forums we have, just trying to pass a point across. And as you can see, part of the photo shows that there are people also sitting around him, including women. So these are things that look very obvious might look very obvious to many people, but in the societies where we operate, sometimes it's a big thing when we see women that are able to articulate them issues with men, and then be accepted or be listened to. We have another story, a small story I wanted to share with us. There's a lady also from that village. She's called Helen Ebei. She's blind. She's a part of our program, and she's benefited from what we do a lot. She did a very nice interview, although it's in a local dialect called Swahili, but we can share the link with transcriptions. People can listen to it. And in her story, she says that she gives a context of that Katilu place. It's very dry, suffers a lot of climate challenge issues, so it's severely troubled. The rivers there dry very often, so crop usually fail. If you try to do agriculture, it often fails. And so then when there's a challenges around food security, then they has those other domino effects on malnutrition. Then children that grow there have challenges with how they grow, and then there's just a lot of problems that then communities face. And so when you onboarded her, amongst others, so she took up the initiative. We engaged in what we call PRA process. It's a participatory rural appraisal process where it's like our community mobilizing approach. When you start working with communities, the whole point of PRA usually is it provides communities with the opportunity for them to prioritize what is important for them, and so that even in the programming interventions we give, we are not the ones who are generating it. It's them who are saying that, okay, in our community, we think 1, 2, 3 is important. So she was part of that process. And so they identified areas they wanted interventions around, and what the key areas that became was food security and water because of the climate challenge issues. And so we've done some interventions around that. And so from in her story, when she says because the engagement during PRA enables them to express either skills they might have or areas they might want support in, for them to be self-sustaining, because our approach tries to empower them in a way that they're not dependent on what you're just doing. So that PRA process tries to encourage them to also volunteer either skills or resources they locally have to contribute also in the intervention that we try to support them in. And so the discussions when they went around, for her, she thought she can do business, but now there are no resources to do business and things like those. So one of the components of the interventions we're giving them is what is it's called VSLA. VSLA means Village Saving and Loan Association. So ideally, this is like a small, locally it's called merry-go-round, where a community of people come together, They contribute money regularly together into a small savings pot, and then they lend each other. So little small loans that have very very low interests that they can never get from banks and things like that. So communities like these have a very challenge, because like if you are to get a formal loan from a bank, it requires a lot of paperwork, requires a lot of you need to provide some sureties and things like those. So the VSLA model allows them to share money and loan each other without necessarily having collateral. Usually they have the social capital. They have, I know him, he knows me, so we trust that he's going to use this money the way we want it used. So she belonged, after being part of our process, our engagements, she was able to form what is called, their group is called Akiporo. Akiporo is a local term here, self-help group. Now where they loan each other. There are about 18 members. They don't give too much money, about $1 a week or $2 a week. But now cumulatively, this is very instrumental for them, because they don't have access to any kind of liquidity, and they don't have access to any way they can raise money to do any kind of business. So for her, when the activity, they embodied it, the 18 members were very active and saving together. So she was able to acquire small solar panels that she put on her house, her village house, and now she was able to offer some little services like phone charging. Locally there, because there's no electricity in those areas, so people come there with their small phones, they charge, they give us some little money. And she was also, and that really was helpful for her to raise money for her little income generation. And then she also began, because of this, the ability to be able to save and borrow loans, she was able to begin a small vendor business of fruits and vegetables. So she buys the vegetables and then sells to the communities around her. And she's become very, very known about this, and she does very well with this kind of business. And then eventually, now she was, when for a period about 6-7 months, the business was doing well. She was able now to even buy a small water tank and install around her house, and now she uses that to also vendor water, because water is very scarce there. So communities, people around her come to buy water from her. And so her story is very interesting. When you met her, you'll expect she's blind, she faces so many challenges as a woman. But we feel that our contributions we have had with her in the work that we do has been very instrumental. So the work we do is that there's just one part in that Katilu area where we work, but the needs are many. The needs for gender justice are immense in Kenya. And like I said, we work in other places in the country. I just quickly highlight another example, another area that we work. It's in the coastal part of the country, a town called Magarini in Mombasa County. And there again, we also do a project where we support maternal and newborn and child health, MNCH. And so the project largely seeks to support, because in that area, there is a huge challenge of something called teenage pregnancies, where we have teens who are mothers. So young girls in their teens who become sexually active, and then they become mothers, and then they face so many challenges. They drop out of school. Sometimes their families what's the word called? So their families disown them, and because they're very young, they have children, they're just completely lost. So this project, that's on one hand. The other hand, the other challenge that these communities have is that they don't have access to health services for mothers who are pregnant. And so usually when we began this work there about 4 years ago, there's a huge number of women who are just giving birth at home. They've never gone to a clinic all their life, during the life of the pregnancy. They have those local, the local assistants, like caregivers in the village who are professional, so to speak, but they're like traditional professional caregivers who support them to give birth at home. But then there's just too many risks. There's too many infant mortality rates and things like those. So our project was trying to intervene around those areas. And so we have, on screen here, we have a lady called Kadzo Kenga. Also, she has a very interesting story as well. She was a beneficiary of our project, and because I experienced was that she's not had any access to the local hospitals in the vicinity, but sometimes the sensitization for them to appreciate why it's important for them to use them is not there. So part of what we are doing with them was trying to uplift their level of awareness around the services that they could access across these facilities. We have established what are called community health workers. So these are just community volunteers who are able to go to door and sensitize these women about why it's important for them to access health services, how they can access them, and when there are complications, how they can have a referral mechanism that supports them into doing that. And so part of Kadzo's story, we also share a link to it. People can read and hear a bit more about it. Is that she not only just benefited from the sensitization process, but also through a similar program like what you have in Turkana in that Katilu place, the VSLA. It also has also benefited her, where she then also is able to access resources now after she's even able to take care of her kids and things like those. So we feel that the immense need around gender justice support exists, but the little steps in where you try to trying to work and support these women is largely try and mitigate the challenges they face. Lastly, the theme for this discussion also was how we as World Renew are trying to use strategic communication in our work. And this is a learning part for us. It's a World Renew is, like I've said, is a global organization, but the decentralized units in different countries, we are not as experienced in some of these conveniences as other countries are. So for us, our experience in World Renew Kenya is since we realize that there's a bit of impact, there's quite an impact of what you're doing, we are trying to strengthen our communication capacity to be able to share the stories we have. And we find that having us here on this webinar is we're very thankful to also share some of these reflections. So part of what you're doing is we're trying to, we regularly raise awareness about our impact in the communities that you work. And we use our communication materials as a way of trying to create partnerships and mobilize support because the work that we do is heavily dependent on donor support. And so we're trying to diversify how much support you can get from people who are listening to us or people who want to hear more about what you do. And we also use our strategic communication to advocate for resources and partnerships, like I've said, where we share our stories like we're doing now here. People might be interested to hear more about them and see how they can be interested to work together or in any way just form partnerships that may broaden the impact you're talking about. We have a local partnership with the TV station here, where every Thursday from about 30 minutes, we showcase our work. We run a small episode there. We call it Hope for World Renew. Hope for World Renew show. So you just there for 30 minutes every Thursday. We showcase some of the work that you do, and you're hoping to do this for at least 1 year and see where that gets us. And then we also try to be very intentional in our participation in forums and webinars where we receive invitations. And it was very kind of you, Chelsea, to have allowed us to share some reflections today on your platform. And then the fifth one is that we document our best practices. We try as much as possible. Like the photo you're seeing there was one of our sessions when you're trying to document, video document our stories. Yeah, so we have a repository of some videos, some photos that demonstrate some of the work that I've talked about. And we'll share some of them, some of those links. Folks can try to look at them and see what you're talking about. And then lastly, we have a strong desire to strengthen our communication capacity. And this is just through learning from others who are doing better than we are doing, and just trying to see how those learnings can help improve the work that we do. Finally, is to be very thankful to you, Chelsea, and the entire Communication for Health Justice platform for having allowed us to share with you here. The photo you see on your side, my camera is not very good, but yeah, the photo you see there is two gentlemen in that Katilu place. They are sitting on traditional stools, and usually this is like the elderly. Usually this is where they sit when they having important discussions. So when we went there after we were collecting our data, they were appreciating us, saying they're thankful for what we've done for them. And they offered us those tools to sit on, which was very prestigious, privileges for them to do that. So we offer the same as a sign of gratitude to you and the entire team that is watching us. Thank you very much.
Thank you so very much. That was so lovely and, thoughtful and just amazing, the work that you are doing. And again, like the first word that I mentioned was intentional. Like, I was taking notes just because you have so many impressive models also in place that um without without typecasting, I feel like I typecast a lot, but like um sometimes I think, at least speaking as someone in the US and like in our Western world, there's sometimes a lot of pressure to, throw out our theories, our models onto other um, organizations or communities. And what I love about what you presented is that you have your own theories and your own models that are powerful and they're working. You mentioned the VSLA. You mentioned the participatory PRA approach, and while there are similarities between the models you mentioned and some that are, in the states, like when you mentioned the participatory research, that came to mind, the kind of models we use here. But I love that you have your own that are in place that you've identified, and you've there's ways that they intentionally work in your community and your communities across the board. So that's terrific. And I'm really interested in learning more about the the work that you're doing, but also kind of, again, like the approaches to how you do it. And you mentioned when it came to maternal child health, the importance of being incremental with that approach, because, working on, I think, MCH, maternal child health, you want to take an incremental approach, not throw the whole, initiative all at once. So, yeah, I just thank you so much for sharing. And I had a few follow-up questions if you have some time for those.
Yes, yes, sure,
Okay,
sure.
cool. And for people who are here, you can also add your questions in the chat, and I'm happy to make sure I share them back with the World Renew Kenya team. So I guess you mentioned this briefly, but how does your faith play a role in the work that you're doing for climate and for gender justice advocacy?
Okay. So, so yes, sorry, yeah, my mic is on. Yeah, so you're asking how our faith plays a role in our advocacy work. Yep.
Yes.
Yes. Okay. So yeah, we are not related, but we are attached to the Christian Reformed Church of North America, and it's just let me get just a moment. I'm trying to.
Sure.
Oh, yes, yes. Sorry, I was looking for how value statements. So yes, we are very here in Kenya. We are associated with the Anglican Church. So we work through partnerships through the Anglican Church. The Anglican Church has a development arm, which is called Anglican Development Services. So all our work, we take it through church. Our mission is very foundational to our faith. And so where our mission reads that we are compelled by God's deep passion for justice and mercy. And so we join communities around the world to renew hope, reconcile lives, and restore creation. That is a statement of our mission. And our vision also is very grounded in our faith, where it states that we envision a world where people experience and extend Christ's compassion and live together in hope of God's community, in hope as God's community. So and then our rallying call is live justice, love mercy, and serve Christ. So from just the value propositions of our work, we are heavily driven by our Christian grounding in the things that we do. So we find that the work around gender justice and advocacy has a huge component of advocating for justice, and this is very foundational for us. We may not be outright activists, who are on the streets and with placards and all, but at the core of our work is to try and ensure that there is justice for everyone, because that's what God intends for us. The compassion that God provides for us intends in itself that there is justice for everyone, and especially those who are marginalized, those who suffer marginalization of different nature. So, and thankfully, I will say in the area where we operate, like in Kenya, there are a lot of opportunities for us to demonstrate this kind of advocacy, because there's a huge level of need of those gender justice disparities.
Thank you so much for sharing. And then I guess I had another question. It's related to the gender justice, approach that World Renew is taking. And so, um, why do you think that gender justice is so difficult to achieve, especially in today's world? So like in 2025, in the whole climate, political, social, economic climate we're seeing today, why do you think that gender justice is so difficult to achieve?
For me, I think if I draw from our context, I think I could think of three things. One is that there are cultural norms that are very entrenched, especially Africa or Kenya. If I speak for Kenya, the place for culture is very strong. Those traditions and cultures are very strong. They're heavily believed, and they are heavily followed. Every community in Kenya has some cultural tendencies that they traditionally believe. And so one way I think the gender justice sometimes suffers challenge in being realized is because of that the huge entrenchment of cultures and tradition in every perspective of life makes it very difficult for community for anything that seems to go against tradition to be adopted. And so, unfortunately, not all cultures are bad. There are some cultures that are good. But unfortunately, the ones that are retrogressive are the ones that are very entrenched. For example, communities we work in, they still practice FGM, female genital mutilation. And there's huge belief amongst communities there that if a woman does not go through an FGM, she's not fit for marriage, she's not a full complete woman, and things like those. And in as much as they sound very weird, those claims sound very outrageous, you talk to people in those communities and you feel the level of belief they have in those traditions is just unbelievable. So then that means that and sometimes the approach you take, for people who are very believing those kinds of traditions, sometimes when you take the hard approach of bashing them, you're saying you people are very retrogressive, sometimes you don't reach them. So our experience has been that you need to try and find a level of sense of awareness creation that can bring them to a level to appreciate that this is just mutilation. You're not helping anyone. So that's one. I think that's because traditions are very buttressed in our culture, makes it very difficult to at least make progressive gender justice engagement. So number two, what I think also makes gender justice, realizing it very difficult is closely related that also with religion. Kenya is heavily a religious society. Statistics say we are nearly 80% Christian, and the remaining 20% are religious of some sort, Hindus or Muslims. And sometimes some of the religious rhetoric, in as much as religion itself is not problematic, in my view, I don't think faith is problematic or opposing to gender justice progression. But sometimes the manner in which we are cultured to appreciate, to practice religion can be retrogressive. And since communities are heavily religious, sometimes when you have conversations that try to elevate women or try to advocate for fairness, in situations where people have been radicalized into some indoctrination that are retrogressive, then it becomes very difficult to reach them, because then some people perceive any attempt to advocate for gender justice as being anti-Christian or anti-religion, and then that becomes a very huge blockage for them. that for us has been something we observe when you work with different faiths, and our attempt, our belief has been that there needs to be a lot of interreligious dialogue that positions or presents gender justice advocacy as not being unchristian, yeah, as being something that is God ordained for justice. God ordains that we do not, those that are marginalized are empathized with and they are supported. So I think for instances where religion indoctrination has been very prevalent in our communities, that can become a blockage to advocates for gender justice. Then the last one is my view again. This is my view that I think that sometimes the level of repercussions for gender violations sometimes are not as stringent as they should be. And this I mean to say, sometimes most of our countries have very, very clear laws about gender violence. If you violate someone, you face this, you face this. But our experience has been that the implementation of those regulations and laws are not very strengthened, such that the laws exist, but there are so many loopholes for victims to find justice. So that then when people are violated, if someone suffers gender violence, for instance, and they're reported to a police station or they're reported to somewhere where they're seeking assistance, the systems that exist there to try and support them find justice are very weak. On paper, they are very strong. When you read it on paper, it's perfect. But when you try to see its application, it has a lot of loopholes. For instance, incidents of rape, for instance, as aggressive as they are, sometimes the requirements, so like for the legal provisions here is when you report a case of rape, you need to fill something they call P3 form. A P3 form is a police form that indicates you've been violated. So you need to go and fill it fast. And so practice has been that you go to police stations and you hear survivors tell you that they were asked to go and fill it somewhere else. Usually they're not even in the police station. So imagining someone here who's been violated, who's been feeling violated, but they're being given a process. They need to go to a chief's camp, get someone to sign something, and so the process itself of accessing that justice becomes very limiting for these people to access justice. So that's for me is like the third part, that the laws exist. Paperwork shows, there are very strong laws against these processes, but the practicalities of some of these laws are very limiting in enabling us to access justice. So for me, I think those three might be why it's very difficult sometimes to realize gender justice, even in the work that we do.
Yes, I mean, thank you for answering that. I know it's a tough, kind of question, but I felt like because it's a heavy emphasis of the organization, it really warrants some answers. And, you spoke to a lot of important aspects of gender justice and why it can be challenging to achieve it. Yeah, I mean, I don't have any additional questions, and I don't see any in the chat at this moment. But for folks who are here or who watch this later, you're more than welcome to send in your questions. And if it is okay with the World Renew team, I'd love to be able to share those questions with you all. But yeah, I guess I'll also add, how can people continue to follow your work?
Oh, yes, so we have our, so we still very new on most social media platforms, but we're doing something about it. So yeah, people can follow us on Instagram. We World Renew Kenya. So all our platforms are called World Renew Kenya. So we're on Instagram, we're on X, we're on LinkedIn, and we're also on Facebook. So yeah, people can follow us and hear a bit of what you're doing through those platforms.
Awesome. Well, thank you so much, Jacob, and the entire World Renew Kenya team. I really appreciate, you being able to come on here and talk. Because right now we are celebrating Earth Month, and with CFHJ, climate-related conversations, sustainability conversations. Of course, they're way more expansive than just 1 month. But it was really nice to be able to highlight an organization that is doing such direct, impactful work in this month of Earth Month. So, thank you so very much. And yeah, I guess we'll close it out here. But thank you so much for your time, and thank you everyone for joining.
Thank you. Thank you so much, Chelsea. We're grateful for the opportunity.
Yes, thank you.
Bye.
Take care.